Did you know that having poor dental hygiene can give you heart disease? Well, you're welcome to our YouTube platform, Health Tips and Tricks. I'm your physician, Dr. Andrew, to take you through. And today we are going to look at the heart once again. And we are going to talk about some of the things that can give you heart disease and how can some of these things be corrected, okay? So, among the things that can give you heart disease, you will see that when you start noticing certain symptoms, and then you go to your doctor will have to identify what is causing your heart disease. And if you are lucky and this can be reversed, then well and good. Your heart will improve and become functional once again. So all these things we are going to discuss today is that once you discover that you have any heart problem, you go to your doctor and they find out what could be causing your heart disease, because that's very important. If you are new to this platform, kindly subscribe so that you can continue receiving our health advice to help you live a healthy life, as well as your relatives and loved ones to also have a healthy life. Now, without wasting further time, we are going to first look at how the heart normally functions. Then we can see what are some of the things that can cause it not to work well or not to function well. So how does the heart work? The heart is an organ in the body located in your chest cavity that pumps blood to the rest of the body and then helps the rest of your body to function, because it needs to receive this blood, nutrients, oxygen, and other things that give the cells energy to function. So we shall inside here is the diagram of the heart, and we are going to see how blood moves. So the heart has two sides. It has a right side. The heart has two sides. It has a right side and a left side. So this is the right side of the heart, and this is the left side. Okay? So the right side basically has a function of pumping blood to the lungs so that the blood can pick up oxygen. Then after the blood has picked up oxygen and is oxygenated, it can now go to the rest of the body to take the oxygen there that is needed for the rest of the body to function. So basically blood comes through all these parts and moves. Now what are these parts called? These are chambers. These parts you see here are called chambers of the heart. Chambers here. And you have the lower chambers that are responsible for pushing the blood out, and the upper chambers that receive the blood. Then you have these tiny things that look like snakes. These are called your valves. These are the valves. The valves, so these are your valves. And then we have, of course, this other big part, and this is what we call the muscle of the heart. So we shall see that diseases which affect the heart can either come from inside within the chambers, they can come from the valves, they can come from the muscle, or they can come from the blood vessels that give the heart blood, and we shall talk about those. So blood flows like this, comes into the heart. This is blue, means the blood has no oxygen yet. Then the blood goes out to the lungs. Now when blood reaches the lungs, it picks up oxygen, and the blood comes back when it has oxygen and is bright red through this side. And this blood which has oxygen comes, and the heart pushes it to the rest of the body. That's how a heart works normally. So, what will happen to make this heart not work normally the way it is supposed to work? One, we can have diseases of the blood vessels called the coronary arteries, or the coronary vessels that help to give the heart blood. Now, the heart is also an organ and also needs blood to function. So, it receives blood through certain special blood vessels called coronary arteries, and these move through the muscle like this to give the muscle blood. So when these coronary arteries become sick, then the heart is no longer getting enough blood, and the heart can become sick and doesn't function well. Actually, when these coronary arteries become blocked, it is the so-called heart attack. When you get a heart attack and your heart is no longer getting enough blood, then it can stop functioning well. So if I could draw these blood vessels here, it is something like this. The blood vessel is like a pipe with different layers. Okay? Now, these are the different layers. We have already talked about some of the things that can cause heart disease. And we have seen that some of the things include things like eating a high-fat diet, especially the bad fat. So what will the bad fat do? The bad fat will come and start sitting in your blood vessels. Sitting there in your blood vessels. And when it sits there, it forms something we call atherosclerosis. Atherosclerosis. Now with this atherosclerosis, it is basically a plaque, and a plaque is a hard thing. Normally a blood vessel is supposed to be smooth, and the blood cells just move through, sliding through smoothly. But once you form a plaque called atherosclerosis, this is rough. So once the blood cells are passing through, they rupture, and when they rupture, they cause what we call a clot. And this clot can become big and cover up the entire blood vessel. Now when this clot covers up the blood vessel, so this is a clot which is formed because of the rough edges. So once this clot forms and covers up the blood vessel completely, this blood vessel was taking blood to a certain part of the heart, it becomes blocked. That part of the heart will die, and it will no longer be supplying blood to the area. So this is what we call coronary artery disease, and it gives you what we call heart attack. And when this happens, it can make your heart not to function the way it is supposed to function. So some of the things which can cause this, we have talked about atherosclerosis, which basically happens because of basically the kind of diet we eat. Mostly the diet which is rich in the bad fats. Then we have other diseases which can happen to the heart. For example, the conduction system of the heart. We talked about the chambers. The heart is supposed to beat in a uniform way. Sometimes the heart gets issues with the way it conducts electricity. That helps it to beat, and you find it is beating irregularly. And then this time we get diseases of the heart because of irregular contraction. And this comes because the electricity which is helping the heart to pump blood is not moving properly through the conduction systems. And some of the things that can cause this include diseases like cardiomyopathy, where cardiomyopathy is heart disease which affects the muscles. We have coronary artery disease, which we have just talked about. We have drugs like diseases like diabetes. We have use of illicit drugs like cocaine. For some of you, there are some people who use cocaine. Now, when you use cocaine, cocaine will make your heart beat at a different rate than normal. So this can lead to disease with the heart beating. And then we have emotional stress. Sometimes when we get stressed, our hearts beat much faster. So when heart beats faster all the time, it can become diseased and stops working well. Too much alcohol and too much caffeine. Caffeine and alcohol also make your heart beat faster. Some of you know when you take coffee, you get palpitations, or what we call the heart beating fast. So when the heart keeps beating fast for all this time, it disturbs the conduction of the electricity, because the electricity which helps it to beat, and the heart becomes permanently diseased. So we also have heart conditions which can be present at birth that affect the conduction systems of the heart, and these make it beat abnormally. High blood pressure, smoking, heart valve, disease of the heart valves, which I'm going to talk about, can also make your heart not beat very well. And also some of these herbal supplements which you use for different diseases, different herbs stimulate the heart. They are heart stimulants, and when they stimulate the heart and make it beat fast, they can make it get diseased. Then we have the diseases of the muscle. So this muscle here can also get diseases and cause diseases of the heart. What are these? The muscle might become enlarged. So when this muscle becomes enlarged, or what we call hypertrophied, we get what we call hypertrophic cardiomyopathy. The heart might become big. This muscle can stretch like a rubber band, and stretches, and the heart stretches and becomes big. This is what we call dilated cardiomyopathy. It can also cause heart disease. And then the muscle can become stiff, so that when the blood comes, the heart doesn't receive the blood because it is stiff. And this is what we call restrictive cardiomyopathy. So these cardiomyopathies have different causes, but mostly they have a genetic component attached to it. And then things like dilated cardiomyopathy can be caused by high blood pressure, which we have already talked about. Things like hypertrophic cardiomyopathy can also be caused by high blood pressure. And then restrictive can be caused by some deposition diseases. There are some diseases called amyloid, where things come from different pathologies or diseases and deposit in the heart and make it stiff. Even diseases of connective tissues, for example, diseases of the joints like rheumatoid arthritis, which is very common. You see many people have painful joints. Some of those diseases can affect the heart. Then we have the valves. Now the valves are these ones which we talked about. So the valves can also get diseased. Now when the valves get diseased, what can make them diseased? We have something called rheumatic fever. Now rheumatic fever is kind of a condition which is common, especially in areas where fever is easily spread, like the tropical areas. And once you get rheumatic fever, it can affect the heart valves and makes the valves sick, and you get what we call rheumatic heart disease, which affects the valves. You can get infection within the heart, an infection, and this is called infective endocarditis, We talked about dental hygiene. If your dental hygiene is poor, you can easily get organisms coming from your mouth and moving to your heart, and they cause the valves of the heart to become sick, and that's what we call infective endocarditis. Then we have things like connective tissue diseases. We have talked about rheumatoid arthritis, which can also affect your heart valves. So those are some of the things that can make you get heart disease. Now, if you get any of these, what are you supposed to do? We said you are supposed to go to a health worker so that this disease is identified and treated early. And what will prompt you to go if you see any of the symptoms or signs that we had talked about in our earlier videos, which you can feel free to catch up with anytime by checking out our channel. Now, there are some other risk factors that you can also make you easily get heart disease, and these include age. The older you grow, the heart also ages. So when the heart ages, it doesn't continue working as efficiently as it's supposed to work. Your sex. For example, if you are a man, men are usually at more risk of getting heart disease, but even women can be at risk, especially when they go beyond menopause or when they are pregnant, they can easily get heart disease. Family history of disease. If your parents have been having heart disease, you are at increased risk of also getting heart disease. We have talked about smoking, unhealthy diet which has too much salt, too much sugar, and too much fat, and this can also lead to you getting heart disease. High blood pressure, we have seen some of the things it can cause. High cholesterol, which also increases the risk of atherosclerosis, which we talked about. Then we have things like lack of exercise, obesity, and then emotional. Poor dental health, which can lead to bacteria moving down from the mouth and affecting your valves and causing infective endocarditis, which can end up giving you damaged valves and the heart which doesn't function properly. Thank you for your attention. I'm your physician, Dr. Andrew, and in summary, we have looked at some of the things that can cause heart disease and what we should do when we realize that we have heart disease, running to our physician or a health worker so that we can get help and get these conditions treated before they grow or before they become severe. Thank you for your attention. Kindly subscribe if you have not and come back to watch our videos. Thank you.